Welcome to another episode of Social Security on CAN TV. Remember, this is a live call-in show, so hopefully throughout this 25 minutes that we have together, we'll be able to hear from you, answer some calls. And remember, to do that, you'll need to call us at 312-738-1060. But before we begin with our program, let's talk a little bit about retirement planning or saving for the future. Social Security partnered with the Federal Treasury Department to talk about My RA, My Retirement Accounts. Achieving financial security is an important part of enjoying a satisfying retirement. A great first step is to check out My RA at www.myra.gov. It's a new, no-risk retirement savings option from the Department of the Treasury, which generates interest faster than your traditional savings. My RA makes it easy and affordable to start saving for retirement. Even if you can only save a little bit right now, it's designed for people who don't have a retirement savings plan through work or lack other options for savings. If you already have access to a retirement savings plan, such as a 401k, learn more about that plan because it might offer matching contributions or other benefits. Check out My RA today. Hello, welcome. I'm Andrew Slaughter, Public Affairs Specialist for the Social Security Administration. I get to have the fun job of talking to you before you get to our Social Security offices so you can be better prepared to handle your Social Security business, whether it's traditionally over the phone or in person, or your convenience online. And we're going to talk a little bit about online planning. Today's guest with me is DeJanette Cummings from our Social Security office. So say hi and give a little bit of info.
Hi everyone. Welcome to our show today. Our telephone lines are open at this time. I am a claims specialist from one of the local offices, and I specialize in supplemental security income disability. And you're watching our live call-in show.
Thank you. And our knowledgeable telephone technician today is Rocio Roman Oquendo, and she'll be happy to take your calls and get you on the air. So remember, to reach us, dial 312-738-1060. So as we get started, one of the biggest things we have, of course, for most young individuals is first, are you too young to start saving, or when should you start saving?
You are never too young to start saving. What's most important is that you actually do start saving. My Social Security account is a very valuable tool for the younger people who don't receive benefits yet. Young workers can use the best free retirement and financial planning tool available. Once you open your My Social Security account, you can have access to, and at the same time, you can download your Social Security statement. With your statement, you can actually review your estimates of your potential future retirement and disability benefits, your estimate of survivor benefits for your spouse and your children, just in case you should die. Your earnings record to confirm the accuracy of those and the estimated Social Security and Medicare taxes that you've already paid into.
And yeah, the Social Security statement online is a great tool because if you've already been looking, because I like to affectionately call our mailed statement Social Security's birthday card to you, because about every 3 months before
Right.
you get one. But we used to do it yearly. But for those younger workers, those under age 60, you get them every 5 years, starting at age 25 and then going on 30, 35, and so forth. So if you're in between that 5-year gap, you might be waiting just to find out what to expect from Social Security as you're taking a look at your retirement plan. You may be looking at it coming up in a couple of months during tax season to get an idea of what to expect. So this way, one of the best ways to do it is logging online, creating that My Social Security card, and then later on you'll just get that birthday email from us. And that's something that'll come every year just to remind you to take a look at your statement. So for those workers that are thinking about retiring or planning on retiring soon, A lot of times as we get to the end of the year, a lot of individuals think, well, let's start out the new year in my new retirement career.
Right.
So what is the earliest age someone can start receiving Social Security retirement benefits?
Well, actually, the earliest age that someone can start receiving Social Security retirement benefits is age 62. If you decide to receive benefits before your full retirement age, which for most people is going to be 66 or 67, you will receive a reduced benefit. But keep in mind that you will not be able to receive Medicare coverage until age 65, even if you decide to retire at an earlier age. For more information, please feel free to visit our Social Security site at www.socialsecurity.gov/retire.
And as the graphic showed earlier, there was that last gray area, and that was delayed Social Security benefits. Delayed Social Security retirement benefits, you can delay up to age 70. So just like as you see on a chart, you get less by going early. You get more if you're patient and wait longer, about 8% extra per year. So that's something to consider when we think about our retirement planning. Because, for example, if you're 62 this year and you go early, that's 75% of your benefit. That means for every $1,000 we owe you, we would pay you $750. But if you waited till age 70 and get 132%, that means for every $1,000 we would be paying you $1,320, or almost 80% more just by waiting. And we are living longer, so it might be something to think about. But even with that, let's think about Social Security not just as a retirement program. Although 81 years ago we started as a retirement program, we are more than that. We are America's life insurance policy for retirement. In the event that something may happen, you become disabled or pass away, there are Social Security benefits. So let's talk a little bit about disability and how can disability help. You know, if it's hard for someone to get to an office because if you have a physical impairment, if you were injured at work, or just you reached your disability prone years as you get closer to retirement, and the wear and tear from having a difficult job or a manual job may have caused those injuries to flare up. A bad back, it may be hard for you to sit in a chair for an hour or two as you go through an interview process. What is another way to visit Social Security's office or file for benefits, or what's the best way to do it, I guess?
Well, actually, you can actually submit your Social Security disability application right online. All of the needed forms are there, right over the internet. Our online disability application is convenient, it's secure, and when you actually decide to apply, begin by looking at our disability starter kit at www.socialsecurity.gov/disability. Applying online actually provides you several different advantages. You can start your disability claim immediately. There's no need to wait for an appointment. You can apply from the convenience of your own home or any computer. And you can avoid that trip to the Social Security office, which will save you time and money. If you'd like to apply for disability benefits, you can use our online application. For more information, please go to www.socialsecurity.gov/disability.
All right, so going online is a great option, but of course it's not something for everyone. Even if you may have assistance with family to file, like if you don't have a computer at home, you may contact your kids or grandkids who are pretty good at the internet probably and be able to help you. But what are some of the other ways? What's the best way someone can start the process if they can't start it online?
In addition, you can, I think the most important thing is actually just to make sure that you make contact with us. So you can call in on our 800 number. That number is 1-800-772-1213. Of course, you can visit us online. And of course, you can walk into your closest local Social Security office.
Yeah, but one of the best ways probably to do it is if you call our 800 number, you can set up an appointment, maybe cut down on some of the waiting time, and even get that starter kit mailed to you ahead of time.
Yeah, it's a really good point. And what I would add to that is you actually have the option of either doing a phone appointment where you do it over the phone, you make your appointment for a future phone appointment, or you can make an appointment to walk into the office. either way, you'll be saving a lot of time.
Yeah, and I mean, either way, you're talking to a Social Security employee, whether it's in person across the desk
Right.
or over the phone where you're still at home and still conveniently located for all your records.
Exactly.
Because it's sometimes hard to carry all those out with you. So we've talked about Social Security, but I always want to slow down and talk a little bit about supplemental security income because it's called SSI, and a lot of times people kind of get the terminology confused. They think Social Security is retirement,
Oh, yeah.
SSI is the disability part.
Right.
So before we start talking about SSI, I wanted to remind our viewers, remember, it's a live call-in show. Even though we're talking about Social Security benefits, if you have a question that's pertaining to Social Security, even if we haven't discussed it yet, please feel free to call us at 312-738-1060. We'll be happy to talk with you over the air and give you some advice or help you along the way.
And if you call right now, there's no wait.
Which is a lot better than a lot of times when you have to reach us. So returning to SSI, how is SSI? What is SSI? Because Social Security is based on our Social Security taxes. What's SSI kind of based on?
SSI is a needs-based program that's available to people that actually haven't worked enough or worked at all and paid into the Social Security system. They provide a kind of a basic assistance that allows you to take care of your basic needs, such as food, clothing, and shelter, I was going to say. So what are the limits? There are many things.
Yeah, I guess one of the things is, if we think about it, because as we looked on it, it showed limited income and limited resources.
Oh, okay.
So
Okay.
I guess the resources probably is the easiest one because we can there's a general amount for individuals and couples and married families.
Yeah. With the resources, what's most important is that you need to have kind of like a bare minimum, and we're looking at about $2,000. We call them resources, essentially cash or cash-like items, less than $2,000. But if you're couple, then the limit on that to still be eligible is going to be $3,000. So what you'll want to make sure is that you have that information available when we have your interview. We're also, have a limit on other things such as cars. You can only have one. Homes, we prefer if you only have one, and that you're living in that home. Burial plots, life insurance. Those things all have limits, and you want to make sure that you have that information available so that we can know if there is any cash value on those things, and to make sure that you meet the program requirements.
Yeah, because a lot of times I remember before being in public affairs, working in a field office like you had, and doing the actual work of paying people, I'd get a lot of questions. Well, can I file for SSI because I own my home?
Oh, absolutely you can. Absolutely.
Now, if you do own, say, a multifamily home and you're getting rent from one part of the home, then that's a little different because then it falls under our income rules, correct?
It does fall under income rules, but that does not mean that you won't qualify. So we do encourage you to call us, make an appointment, to come into the office or speak with one of us on the phone, or of course you can visit us online at www.socialsecurity.gov/disability.
Yeah, and I think that's one of the most important things I'd like us to kind of step back and cover is a lot of times as we talk about this over the TV program and just give you some ideas about Social Security, we don't want to say that if you fall under these categories, you may qualify, you may not. But the best way to do it is actually starting the process by calling us at our 800 number on screen or visiting us at our Social Security website. So as we're moving along, hopefully we get a caller soon, so that we can talk to someone and give our voice a little bit of a break. So remember, give us a call at 312-738-1060. Now we talked mostly about the planning part of if you haven't been receiving Social Security benefits,
Right.
What you can do with the My Social Security account, how to file or get more information about Social Security benefits. And what I really want to do is, go to the second part. Social Security sends out about 60 million checks a month. Yes. So we're paying Yeah, 60 million. I'm trying to remember if I have the right M. It can't be 60 billion because we don't have that many people on the planet yet. But we're working toward making sure that we get those checks out timely. But there are some things that you can do when you change. When you start receiving Social Security benefits and you need some services, we also have the My Social Security account. So, let's talk a little bit about something that always comes up, aside from replacement Social Security cards, which still have to do in person. But that Medicare card is kind of flimsy and can get washed or torn or just ripped. And what's one of the best ways to actually have proof of the card or get a replacement card?
One of the best ways to get a replacement card is to go and actually set up the My Social Security account. Your Medicare card is proof of your medical insurance. If your Medicare card was lost, stolen, or destroyed, you can ask for a replacement right online, right through your My Social Security account. If you don't have one, we encourage you to go in to sign in or create an account. Once you've logged in, please hit the Replace Documents tab. Then select Mail My Replacement Medicare Card. Your Medicare card will arrive in the mail in about 30 days at the address that we have on file with Social Security.
All right, so what we'll do is we'll take a little bit of break because I had shown what we can do online really quick while we were covering that. But we do have a caller, so let's take a caller on the air.
Oh, great.
Caller? Okay, caller, are you on the air?
Hi.
Hello?
Oh, yes,
Hi.
we have it now. Hello?
Hello?
Yes. We hear you.
I can't hear you.
Okay, we can hear you, so do you have the phone on? Because...
Yeah, I have the phone on.
Okay, so what is your question?
So what?
What is your question?
I was calling to see, well, I get sick and I'm only 61. So what do I receive, disability or Social Security?
Okay, that's a very good question, and you have a couple of options. You have a couple options. Retirement doesn't start until 62, so since you're under age 62, you'd be looking at filing for our disability benefits. You can file for both our Social Security disability and possibly Supplemental Security Income, SSI, to see what you qualify for or how much we can pay. So one of the best ways to do that is you could either start the process online or you can do it over the phone by calling our 800 number to set up an appointment. So as you see on the screen, just remember you can call us at 1-800-772-1213 and set up an appointment to start the process, and visit us online so you can do the paperwork. Okay? And we're open till 7 p.m. for our 800 number. Alright, that always works out. That's nice that we actually have a
live
call and we
caller.
were able to help someone out. And
Right.
the part about Social Security is we always like to be here to help guide you with the process or make sure everything's going right. And one of the things you can do, like we always say, the convenient way is visiting us online so you can get a replacement Medicare card, a 1099 if you have delayed filing your taxes or if something happens next year. But if you're changing your address or even your direct deposit account, you can do that with a My Social Security account. And as most important thing, if you ever need to verify your Social Security benefits, you can get a proof of income letter online right away.
Instantly.
Yes.
It's amazing.
So,
Save you a trip to the office.
So as we work our way through things, what I wanted to do is go a little bit into our disability part, because we talked about the process of completing the paperwork, and it's kind of several steps are involved because you have to apply the application, you have to provide us with the medical
Sources.
history, sources, things like that. And then we have to get the authorization to get those records. So the process can be lengthy and it does take some time. And occasionally we may not receive all the information or may not make a decision that you agree with. In this case, we may not find you to meet our requirements. So what can someone do if they receive a letter stating that that we did not find them to meet our medical disability requirements?
I think the most important thing that you can do at that point is to read through your letter and do your appeal. Appealing is when you ask us, Social Security, to review your last decision and that you're disagreeing with the fact that we've declared you disabled. When we make a decision on your application, we'll send you a letter explaining our decision. If you don't agree with our decision, you can make an appeal. That is, you can ask for us to look at your case all over again. You must appeal within 60 days from the date that you actually received the letter. You can file a disability appeal online and provide additional documentations to support your request electronically. You can file an appeal online even if you live outside of the United States. Of course, you can always call us, as we stated earlier, at the 1-800-772-1213 number. And what that allows us to do is to make an appointment for you to either do your application, your appeal rather, over the phone or come into the office. But what you want to make sure you do is if you have additional documentation, you want to provide it to us, but you also want to make sure you take action and actually do your appeal. You don't want to let that letter sit there or get, disgruntled. There may be some important information we missed.
Not to give up. So what we'll do before we wrap up is let's take one last call. Always like to talk with our viewing public. So caller, you're on the air. Hello? Caller?
Hello?
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 Hello, we're here.
I'm just Miss Wani. I tried to apply for link card, but I was denied because I have no social security number because I'm not citizen of United States. I am on visa. I'm just immigrant.
Okay, unfortunately, it can't help you with the link card with the assistance through Illinois Health and Human Services because it's a state-run program, and they do have certain state requirements. Same with Social Security. Social Security benefits for like SSI, Supplemental Security Income, you have to meet certain requirements as well, where if you're not a citizen, you had to have worked under Social Security or paid a certain amount of credits to qualify if you became a permanent resident after 96. So there are certain requirements that both Social Security may have for assistance programs as well as the state of Illinois. I would say you may want to take a look at some other services. If you're here on a visa for school or something, maybe they can assist you on things like that. But unfortunately, we can't help you with the state of Illinois question. However, what we can talk a little bit about as we wrap up our show, and it's not something that Social Security does, but it's through the Department of Health and Human Services, and that's the Affordable Care Act. The Affordable Care Act is something that affordable health care, I should say, something that all Americans deserve. Before the Affordable Care Act, millions of people and their families were at risk of financial ruin because they were uninsured. Health insurance companies could also deny health coverage due to pre-existing conditions like cancer or diabetes. Fortunately, you are now protected with the ACA. So no matter who you are entitled to affordable health care. It is a crucial part of securing today and tomorrow. The Affordable Care Act also ensures that even if you have a pre-existing condition, you will be covered. So, if you want to change your plan, this is the time to do it. Factors might have changed over the last year that would make you want to update your coverage. Even if you're just curious about what plans are in the open market, you can compare healthcare plans at www.healthcare.gov. However, if this is the first time that you're filing for healthcare coverage, you're going to need to make sure you enroll by December 15th to have that coverage start as of January 1st. And the open enrollment has started November 1st and rolls through January 31st. So with that, we're wrapping up our program, and we're happy to be able to have helped you, provided you with a little bit more information from Social Security. So thank you for watching Social Security on Cable Access Network, CAN TV, and we look forward to seeing you again next Wednesday with more answers to your questions. Thank you.
Thank you.